Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 6. In this video, we're going to cover two coding clinics. And the first one is Laora body disease and the second one is chronic migraine with and without intractable aura. Let's get started with the first one, Laora body disease. And the update here is category G40, epilepsy and recurrent seizures has been expanded to create codes to capture Laora body disease. The new codes are as follows: G40.C01 Laora progressive myoclonus epilepsy not intractable with status epilepticus. G40.C09 Laora progressive myoclonus epilepsy not intractable without status epilepticus. G40.C11 Laora progressive myoclonus epilepsy intractable with status epilepticus. G40.C19 Laora progressive myoclonus epilepsy intractable without status epilepticus. Laora body disease or Laora progressive myoclonus epilepsy is a rare brain disorder characterized by recurrent seizures. It's an autosomal recessive condition that is caused by a glycogen metabolism disorder that results in the accumulation of abnormal glycogen aggregates called Laora bodies in the brain, heart, and liver. This accumulation causes a progressive degeneration of the nervous system, which results in generalized tonic-clonic seizures, occipital seizures, myoclonic seizures, tonic, absence, and atonic seizures. The signs and symptoms of this disorder usually appear in late childhood or adolescence and worsen with time. Patients with Laora disease may experience a rapid cognitive decline with gross and fine motor regression. Other symptoms of Laora body disease include behavioral changes such as depression and confusion, and physical symptoms such as ataxia, difficulty controlling muscles, difficulty walking, difficulty eating, dysarthria, that is difficulty speaking, and childhood dementia. Affected individuals usually lose the ability to perform the activities of daily living by their mid-20s, requiring comprehensive care. Therapy for Laora body disease is primarily palliative and focused on reducing seizures. Now let's move toward the next coding clinic, chronic migraine with and without intractable aura. And the update here is category G43 migraine has been expanded to include new subcategories: G43.E chronic migraine with aura, G43.E0 chronic migraine with aura not intractable, G43.E1 chronic migraine with aura intractable. The newly created codes are as follows: G43.E01 chronic migraine with aura not intractable with status migrainosus, G43.E09 chronic migraine with aura not intractable without status migrainosus, G43.E11 chronic migraine with aura intractable with status migrainosus, G43.E19 chronic migraine with aura intractable without status migrainosus. A migraine is a common multifactorial brain disorder with recurring disabling attacks of moderate to severe throbbing and pulsating pain on one side of the head. The pain is caused by the activation of nerve fibers within the wall of the brain blood vessels traveling inside the meninges. The International Classification of Headache Disorders, 3rd edition, defines chronic migraine as a headache occurring on 15 or more days a month for more than 3 months, or at least 8 days a month, and has the features of a migraine headache. Chronic headache criteria includes both migraine with and without aura. Auras are visual, sensory, motor, or verbal disturbances that precede the migraine or occur during the migraine episode. Please like, share, and subscribe to Expert Medical Coding. Thanks for watching.